I want to, first of all, thank very much Dr. Chinmaya for his great presentation. And I would like to introduce the next speaker, Dr. Subhrojyoti Bhowmick. Is a doctor, a gynecologist, and pharmacologist. And he's a clinician. Please, is involved in as a clinical director at the Peerless Hospital and BK Royce Research Center in Kolkata in India. So meaning that he's really in the center of the medical aspects of vaccination. And I think that it's also a center for vaccination. And he is also an honorary lecturer in the Institute of Clinical Sciences in Birmingham, UK. The floor is yours.
Thank you, Dr. Irene, and thank you everyone who is staying back after those lovely two presentations. I mean, it's the tail ender's job to finish the batting line, as they say. So let me just pull in my presentation. Thank you once again for this opportunity, and I feel privileged to be amongst this fraternity. Let me know if my slides are visible.
Yes, it's fine.
Okay, thank you. So I'm going to complete, I'm actually, as Dr. Irene mentioned, that I work in a hospital which has currently 250 COVID patients. We are a 400-bedded hospital. I have seen close to 1,000 patients in the last 6 months in India. And I've been forced, because I am basically a clinical researcher. I am the head of clinical research here. I've been involved in the Sputnik vaccine trial in Eastern India. I am also leading the Johnson & Johnson vaccine trial in the country, in Eastern India. But the conditions in the country are now so such that every doctor has to pick up, the pen and the prescription to save as many Indians' lives as possible. Because a lot of Indians are dying on a regular basis because of the second surge. So my session today will be on digitalization and pharmacoepidemiology of the Indian vaccination program. Some of the slides might be overlapping with my first speaker, Dr. Maya Sharma, because I think our ideology and the concept, which we both think were absolutely similar. My hospital is located at the eastern part of the country. So I come from the city called Kolkata. And if you really look at these statistics, we are in the mid of the second wave. India is really in mid of the second wave. You see that huge spike which has gone up. And look at those cases. We are just the worst. I mean, we are behind the United States. And we have lost close to 2.7 lakh Indian lives in this wave overall. And 2.5 crore Indians have been infected, and these are our states, and where there are cases, but the good thing is that the cases are coming down on a regular basis. My data is a source from the Indian website mygovernment.nic.in, and we have been vaccinating people. It's not that we haven't been vaccinated people. There is a sizable portion of people who have been vaccinated, but then this is just probably 1/10 of our population. There are people who have received, we have total doses which have been around, if we talk about yesterday, there have been 18 crores now. In 2 days, we have vaccinated from 16 crores to 18 crores, but the dosage are really...
Excuse me, can you say what is crore and what is lakh?
Yes. I'm sorry. So one crore is 100 lakhs. So 1 lakh is, I would say, 1 lakh cases is 100,000. 1 lakh is 100,000. 1 lakh is 100,000. So 100 lakhs is 1 crore. So that is, so you put it into 100 times. So it is actually 100 million cases. 100 million. So 1 crore is 100 million. So now the biggest question which comes is this data credible? I think Dr. Vipasha was actually asking this is this data credible? The answer is yes, this data is credible because this data is not coming from, not the Indian government is making it up, because India has been focusing on digitalization since 2014 with Narendra Modi as the Prime Minister of the country. He has focused on digitalization of all services, including the government services. So Digital India is the focus. And let me take you back to 2020, where we first set up this app, which is Arogya Setu. Arogya Setu in Hindi or in the national language means that this speaks about what is the health of the individual. This was launched by the government of India on 2nd April 2020, and it's a mobile application which is developed by the government in association with IT companies. We did not forget that India is one of the IT leaders in the world. And why we wanted this is because everybody who had a smartphone, they could put in their data. And this is an app which was used by the Indian public to navigate the knowledge and surrounding status of COVID prevalence in real time. So if you go to the Arogya Setu app, you will see that this is the app which looks like it is available in 11 Indian languages. There is a QR scan which we can help and it can download it. And this is the Arogya Setu mobile app. Once you download the Arogya Setu app, this has the facility to schedule vaccination process for you. It can schedule the vaccination process. And I'm going to talk about the next registration, which is the Kovid app, which has been developed in the year 2021, which is being incorporated in the mobile app of Arogya Setu. Why was this app developed? The app was developed to augment the initiatives of Government of India, particularly the Department of Health, in reaching out and informing the common public about risk, best practices, and advisories. So every time there would be a new advisory, there would be a pop-up coming out from the Arogya app, and this Arogya app had to be downloaded by everyone who was traveling in the country with a negative RT-PCR report. So the RT-PCR report was visualized in the app, and the app, if you did not download the app, you were not allowed to travel through the airlines in the country. It tracked Bluetooth and location generated social graph, and the app plays a very, very important role in the country today for registration of an individual for a preferred slot for getting vaccinated. This is the Arogya Setu app, and what did the Arogya Setu app also do? It spoke about your COVID-19 status. So the moment the sample is collected by any ICMR, Indian Council of Medical Research laboratory, which is approved by ICMR, you will get a sample requisition form, and the sample requisition form shows up on your Arogya Setu app. And when the sample is collected and analyzed, if you test positive, then the Arogya Setu changes its color from green to red. When you are red, then it's understood that you are COVID infected. So anybody who has the Arogya Setu app is able to understand within his vicinity of a kilometer how many COVID positive patients are existing. So every report is kind of linked to the Arogya Setu app, and this is what digitalization is doing to the country. Now, how do we vaccine? How, if you want to schedule a vaccination status, so Arogya Setu helps you to schedule your vaccine state. So if you know vaccine in India, whether it is Covishield, whether it is Covaxin, or it is the Sputnik vaccine, can be given by any hospital, including my hospital, unless and until the person is registered on this app or is registered through the online portal. So once you get the registration done, you have a one-time password which comes in, and then the name shows in your app, and you will be given the areas where you want to go and get vaccinated. So this is totally being done in a digital manner in the country. And once you want to schedule, you can select a date and select a timing. And once you select that, you go to that hospital or to the community vaccination center once you schedule this. Now, Arogya Setu was the government's initiative in 2020, but when the government of India decided on 16th of January that millions and millions and billions of people will be vaccinated, they understood that in a country like India, where there is a diversity of rural population and a very, very modern, ultra modern urban population, they would require another digital platform, which is the Kovid app. And this is the COVID-19 Vaccine Intelligence Network. This was developed with the help of UNICEF, and this is become one of the most important end-to-end solution in the public health system of the country, where the vaccinators are able to understand whether they are vaccinating in the proper way or not, and the vaccinees who are receiving the vaccines, they get their every information, including the vaccine certificate, through this CoWIN platform. This CoWIN platform is a real-time platform. It tracks not only the beneficiaries, but it tracks the vaccine at the state, national, and district level. So this is the CoWIN registration platform, and we can go and we can search through our PIN code, which is the 6-digit number of your locality if you want to find your vaccination center, or you can search with the help of your districts. So CoWIN app, once you register with the CoWIN, you require certain important documents to prove that you are a legitimate Indian citizen to get the vaccine. So you have to upload either the voter card or your PAN card, which is the income tax document, or the Aadhaar card. This is the social security card which the government of India has given to every citizen of the country. So this has to be uploaded onto the CoWIN app, and the CoWIN app is playing a very, very important role in not only monitoring the numbers which we are talking to the rest of the world, but the CoWIN app is also monitoring the adverse event. As one of our participants was asking that whether these numbers are credible or not, the CoWIN monitors to a certain extent the adverse event. So what happens at the vaccinator level? This is the facet which is seen at my hospital level. We can directly log in, and once we log in, we can see the patient's details. And if we want to look at any reports, and just look at this. There was question about whether the AEFI were properly managed or not. If the moment the registered person comes into the hospital and gives us the credential, we will look that person up in the CoWIN app. And till the time the person is with us, and the time is not less than an hour, of which 30 minutes dedicated monitoring is required for an immediate adverse event. We have to, if there is an adverse event which happens, we have to report the adverse event here. We have to, when we report adverse event, there is a structured way so that this can be done in the villages also. A question was asked that whether villages are reporting this or not. The villages cannot vaccinate unless and until they have the CoWIN application. So at least the immediate vaccination, emerging adverse events are being captured. So we apply and then there are different questions, if there are comorbidities, we are looking at, so this data is being captured. And these are snapshots which I have taken from my hospital and I'm presenting this to the audience here. And what kind of adverse events happened after 30 minutes of vaccination? There was anxiety. Many of the people in my hospital, in our hospital, reported that they were having breathlessness, whereas their saturation was as high as 99%. And when we counseled them, they said that we are very, very anxious. We have luckily not encountered any anaphylaxis, though as per the rules and regulations of Government of India, we must have an anaphylactic kit ready. And when the vaccination process goes on, whether it is in a very big hospital like ours or in a small primary health center, the anaphylaxis kit, which consists of adrenaline injection, hydrocortisone injection, and the syringes and the needles, is given by the government. The government ensures that the anaphylaxis reactions are managed, and then we record. This is the record which is being captured on the Kovid app. What kind of events can happen? Who is even death? If there is death, which is, so this is being captured in the Kovid app. These are real-time capturing which the Kovid app is doing. And it's also sometimes the people are coming back to us. There are people who have come back after 7 days and they said that I have got a swelling on my hand. This doesn't look good. What do we do? So our vaccinator opens up this site. We are able to open up this site and we are able to put in the symptoms as well as whatever the adverse events are when the patient, when the receiver comes back to us. So one of the most important and interesting part before I get into the epidemiology part of our vaccination program in India is that India started phase-wise vaccination. India did triaging of the vaccine, and that was a right thing to do, like any other country in the world. We are a 135 crore, and let me put this 1.3 billion population, really the population of, I would say, 10 Europes put together. And we decided that we will have 30 crore Indians to be vaccinated on priority, of which, the 100 million healthcare workers will be given the first priority. The point two, I would say, the frontline workers, other frontline workers will be given, which includes the police, the Indian Army, the people who are the ambulance drivers. They would be given, the media persons, they would be given the vaccines after that. And finally, it would be opened up for the elderly people with 26 crore population. And this was done in a phase-wise manner. If you look at the COVID statistics, and this is taken on 18th May, 42,226 vaccination centers exist in the country as of now. The numbers have decreased. Yes, the numbers have decreased because we are not able to get the vaccine. I will come to this, why we are not able to get the vaccine. Did India did a mistake? But 42,226 vaccines, of which the government is running 41,113 vaccination centers. 1,213 vaccination centers are being run by the private institution. You see the total registration numbers, the total dose, this is being captured and how it is being captured, because nothing which is entered onto Kovid app, onto the Kovid platform, will be able to get the vaccine. Patients, the recipients cannot get the vaccines unless and until this kind of registration happens. Primarily, we have vaccinated with Covishield and Covaxin. Sputnik vaccine has begun in the country just 7 days back. So I must congratulate the Government of India for at least giving free of cost vaccine to all the healthcare workers in the country. This is a great gift, I think, what we got from the government. But as a healthcare worker, we got Covishield. But I would have been very happy that if we could have got Covaxin, our own vaccine, because Covaxin production was less. And at that point of time, there was a huge hue and cry about Covaxin's less published data. Covishield or the AstraZeneca vaccine had the advantage of more published data, so the government wanted to give that vaccine. But now when I look at hindsight, as the data of Covaxin is being published worldwide in Lancet journal as well, I believe that Covaxin is going to be the next game changer in our country. If you look at the statistics on 13th May, there we aspired that we will vaccinate 100 million people, but could we do that? The answer is no, because there was vaccine hesitancy among the healthcare workers. There is vaccine hesitancy in the frontline workers. If you look at the 18 to 44 years of age, this has just begun. on 1st May, because we were sequentially coming down. We were coming down from the healthcare workers to the frontline workers to the aged people with comorbidity, and finally the young people from 18 to 14 years. This is the government strategy to manage to triage the vaccine, which is so less in number. This is the statistics which clearly mentions that more people have got the first dose and there are less people who have got the second dose. But why is the vaccination so less? Because there is a lot of vaccine hesitancy, and newspaper dailies, the major newspapers in the country have reported this, that there are many districts in northern India where the vaccine were wasted. The southern state of Tamil Nadu has a vaccine wastage rate of 10%. 10% of the vaccine was wasted in the southern state because we had lot of questions in mind, because the people were not convinced that a vaccine could be developed as early as in a year's time. The phase 3 vaccination is the current vaccination which we are in. And government has opened it up for 18 years and above. There is the other thing which has come and changed in this vaccination process is the private hospitals like us can directly purchase it from the manufacturers. This was not there, and we are facing difficulty now. We have to directly talk to the serums and the Bharat Biotechs and the Dr. Reddy's laboratory, where they are not paying much heed to the private players. They want to sell the vaccines to the government because of obvious reasons. So manufacturers have been incentivized for upscaling production, attracting new national and international players. As my first speaker was showing, that the Sputnik vaccine will not be only developed by Dr. Reddy's laboratory, but will be developed by another 5 manufacturers, of which few manufacturers supply a majority of the formulation like capsules and tablets to all the countries in the world. If we really look at the vaccination, and this is the data from the Kovid app, the majority of the vaccine, 90% of the vaccination in India has been done by the AstraZeneca vaccine. Only a meager 10% from the Bharat Biotech. Male, females have been vaccinated, but unfortunately transgenders have not been vaccinated so much. In fact, the latest vaccination policy mentions transgenders and LGBT communities to be vaccinated on a priority basis. This is a slide which I have borrowed from Dr. Chinmay, and this AEFI has been directly extrapolated from the Kovid digital platform. And the Kovid digital platform mentions that there are 20,430 AEFI which has been reported. So with the help of so much of difficulty, but with the help of digitalization, I would say India is reaching one landmark after the other. Though this is inadequate, but I think being a positive person by nature, I believe that we will be able to administer more vaccine as the numbers now come down. The numbers have started coming down really, really well. This is a snapshot since yesterday. This is the number of people who have been vaccinated. If you really look at the number of people above 60 years, many of the European nations we would have covered. We would have, if our size would have been of that size, we would have covered many European nations. But this is the size of vaccine which has of the vaccine distribution which we have given. The biggest crisis right now is the vaccine shortage, and I think we are facing this in our own institution as well because of many reasons. And the vaccine, whether it is Covishield, Covaxin, or Sputnik, is not much there, and the process has slowed down. And again, this is a common slide from Dr. Maya. I would say, did India make a mistake of exporting the vaccine when other countries, the other developed nations in the world decided to think about themselves, and India decided to help the lower and other middle income countries in the world and not think about its own population. I personally, as a medical physician, I believe that India did a wrong thing. India should not have exported the vaccine, because the kind of death, the kind of crisis which we are witnessing right now could have been prevented if we would have just kept the vaccines to ourselves. But maybe that is not the ideology of the Indian government. But there is hope at the end of the tunnel, because the strong pipeline of Indian vaccination program and the clinical trials give us a lot of hope. We are very hopeful that the number 3 Zycov-D, which is our indigenous vaccine, it's a DNA plasmid vaccine, which is developed by the Department of Biotechnology in India, will be approved in a couple of weeks from now. Sputnik is already on the way to be rolled out. The Serum Institute is already on, it's developing the protein virus vaccine, and we have a nasal vaccine which is being developed by none other than the Bharat Biotech. So to summarize my presentation, I would say currently India's vaccination program is in the midst of COVID-19 second wave, which is very active. But measures like lockdown, 80% of the country is in complete lockdown now. And the vaccination process, though it is limping, it is helping the cause. The cases are coming down. We are now able to breathe. The doctors are able to breathe. The nurses are able to breathe. The hospitals are able to breathe. India's digitalization of the vaccination process is a success story, and we don't need a certificate from anybody in the world. We have done this in the most difficult way, and every data is accounted for. We cannot vaccinate any individual in the country if that person is not on the COVID app. We are very hopeful. We are very hopeful that more COVID-19 vaccines will be approved in India in the next few months, and this will help our nation to decrease the dearth of vaccine and increase number of cases. We expect the entire world to help us during these phases by giving us more vaccines and at least some kind of oxygen concentrators, and the world is helping us. Let me conclude by saying that this is a disease where no one is safe until everyone is safe. So whether this lady who is standing outside the Pfizer headquarters in New York, she is claiming and she is protesting. She is an American and she is protesting that the vaccine should be it should be given for free. That is the same thought which we have in India right now, that India needs help. And I believe that if India is not safe, then the world cannot be safe as well. With this, I would like to conclude my presentation and again thank Dr. Irene as well as Dr. Chinmay for giving me this opportunity to be part of this August gathering. Thank you. Dr. Irene, you are muted.
So, thank you so much. Thank you for this great presentation, and I think that it's a very, very interesting application, because I understand that this is an obligation for everyone to be vaccinated, to be inside of this program. And what is just jumping in my head is that if we see that for instance, in Israel, all the 90%, more than 90% of the medical data are digitalized. And because of that, we have been able to give some data in the real world about mRNA vaccine for Pfizer-BioNTech. And then you will have the 2 vaccines, and after that, Sputnik also for the beginning. And then you will come with your epidemiologic data for AstraZeneca, for the Bharat vaccine, for the Sputnik vaccine, and after that for the other vaccines. And we will be able to make a comparison between the efficiency and the safety of all these vaccines. And this is really very, really fascinating that we will be able to do that on some time. It will take some time, but at least we will be able either to improve these vaccines or to know exactly about what is it in real life. So do we have any more questions? I have a lot of questions, but please, who wants to ask question?
Oh, sorry. Someone else is. Okay, go on.
I'm sorry. That was an awesome presentation. Thank you so much. Firstly, just a clarification. In the U.S., as in many countries, vaccines are free to everybody getting vaccinated. So I just wanted to make that clear.
Yeah.
It's a great app. In fact, I downloaded it from your slide, so I'll delve into it. Has the contact tracing capability of the app impacted social behavior at all? And then a second question is, how do you, as healthcare providers, address things like lemon juice and other misconceptions about treating COVID-19?
Right. So to answer your first question, I would say, Peter, that the contact tracing thing can only work if everybody is efficiently using the app. So that is one biggest, I would say, late remitting step, that everyone around has to use the app. But what happens, and I'll tell you because I'll share my experience. I was COVID-19 positive last year. And so the moment my report became positive, my Kovid app, my Arogya Setu became red. So every time I would kind of, I would try and see from another person's phone, and that was my wife's, and that was showing that there was a person who was COVID positive within so much distance of yours. So the contact tracing definitely works if the person concerned has the moment, because these are all in the loop. The moment you go to an ICMR approved laboratory, you are given a specific number and ICMR is tracking it, and the report gets tracked onto your Arogya Setu app. So your app will become red for 17 days. Now it has been reduced to 10 days by the government. So 17 days the app is going to be red. So if you go to, if you go to markets or you want to travel, you have to show what is the status of your app. I mean, at least when you're traveling by air. So if people around you are kind of looking around, so they will be able to figure out whether you are positive or negative. Now, the second question which you asked, and I must tell you this, that India is, as Dr. Maya mentioned, India is, it's an accumulation of many nations together. We have the Western medicine, but we also have our own indigenous medicine. Like when I would compare it with Iran or Persia or Egypt, a civilization like the Egyptian civilization. So Indian civilization is 5,000-year-old civilization. Is Western medicine has come to India for last 200 years when the British ruled us. Before that, we had our own Unani, we had our own allopathy, medicine, and homeopathy, and all those pathies. So lemon juice and all will always be there. But frankly speaking, I would say that when we deal with patients, we always talk about evidence-based medicine. Currently, if you ask me, the government of India has laid down evidence-based guidelines treatment, and we follow the evidence-based guidelines treatment. And I'm very happy to share with you that these evidence-based guideline treatments are up to date and they keep on changing. Just to give you an example, that plasma therapy, which was not working in the country, has been dropped recently, which is yesterday they dropped, though 7 months they were advocating it. So we have to agree to the fact that we are too many nations together, too many ideologies together, too many religions together, too many people together. And this diversity is our strength. This diversity makes India a unique place to live.
Thank you. It's just interesting that, as we in the U.S. and the West, as we have our own problems relative to, fake cures and kind of bad science, that we're not alone, that the rest of the world is suffering equally for different reasons. Thank you.
Yes, we also do that. But having said that, freedom of speech, at least right now, is one thing which we are ensuring in the country, if not anything else.
There's a great quote from a former U.S. Senator named Patrick Moynihan. he said that people are entitled to their own opinions, but not to their own facts. So it's an ongoing battle that we're all fighting together.
Absolutely.
I wanted to ask if you have learned from if you are mixing sometimes Ayurvedic medicine with Western, let's say, evidence-based medicine. I'm sure that we have also to learn from this kind of medicine when we are able to choose whatever, and we have the knowledge of both medicines.
Yes, that's a great point. And let me tell you, the Department of Ayush, which is there, the Ayurveda, Unani, Siddha, and homeopathy. There is a separate department of Ayush by the government of India, which is regulating the use of these medications. They have evidence-based, and I'm not an expert in that, so I should not say that, but I can tell you it's a regulated environment. But as Dr. Peter said, it is, we have fake treatments as well. So we have that issues and we have that problem. The only thing is awareness, as Dr. Arshia was saying, that we need to increase awareness. Every forum we get, the media is working day in and day out. Kudos to the Indian media, that Indian media is working day in and day out. And Dr. Irene, if you're in India and you're calling any other second person, the caller tune is of how you can save yourself from COVID-19 or how effective is the Indian vaccination program. So these small things are about increasing the awareness of a nation where we still unfortunately have about 20% of the population which is illiterate. So we have our challenges, but we are trying to figure out our solutions as well.
I would like also to ask about a question about the Sputnik. I have read recently, I think in the Lancet or the New England, that in the Seychelles, there is infection of COVID after the Sputnik vaccine especially, and that is perhaps showing that there is a decreased efficiency of the Sputnik. How do you react about that? Because it's really frightening.
Yeah, Dr. Irene, I think I usually will go by the data. Frankly speaking, the Indian Sputnik phase 3 trial, which I was a part of, the data is still not published. It is under publication. So I think I should refrain from commenting on that, because my own center, we have not experienced that. We have a very limited experience of only giving it to 30 odd participants. But I think the the entire national perspective can come out from the publication, which will have for 1,500 participants of that trial. And that will be very soon. We are being told that in July, the vaccination process ends, the trial ends, and they will go for a peer-reviewed publication. So I think we should wait till that to reply to your question.
Okay. Any questions? I think that many questions are just boiling. Other questions?
Yeah. Hi, Irene. This is Arshia. So I had one question. So somebody asked about the breakthrough infections from Covishield and Covaxin. So, I had some data that I looked up, and just give me a moment. Yeah, so according to that data that has come out on 18th of May, it is around 0.13% for Covaxin and 0.07 for Covishield, percent for Covishield, as the data that I see that has come in India today, which is a magazine. So that's one. So what needs to be seen, and this is a question that I would like to put to everyone present here. So for the breakthrough infections as well, what needs to be seen is how severe the infections are, because that is what also the vaccine helps with, to reduce the severity of the infection. And if you Irene or Peter, if you have such data from in Israel or in US, that how the vaccines have helped in decreasing the severity of the infection, since I think in Israel and US, mRNA vaccines have been majorly used. So how is it, and how what kind of studies have been done for that?
You know, the data that I've seen relative to breakthrough infections, it's at this point, it's still very anecdotal. You know, but one thing is very clear, and it's very hard to communicate, is even breakthrough infections are far less severe than infections minus vaccines. And even though that doesn't sound like a super complicated concept, it's proven incredibly difficult to communicate to the general public.
I would add, in Israel, we have just published the epidemiologic data on effectiveness, and I think that all the data that have been published in US, in Israel, in Denmark, in UK, are showing exactly the same trend, that if there is an infection after the COVID, after the vaccination, that could be with the mRNA vaccines or with AstraZeneca, like in UK, it shows clearly that the severity and deaths, the number of deaths, is really very, very low when you have been vaccinated than when you are not. So even if it's not, if the risk is not zero to be infected with a vaccine, any vaccine, the fact that the morbidity and mortality is much more lower than without vaccines, it's speaking in itself. And I join absolutely Peter about the fact that the small part, at least in Israel, the small part which is still not vaccinated is very, very difficult to convince, because people are now, and especially in Israel, we are going back to normal life. Let's say a normal life on a sanitary point of view, because right now it's really not normal life with all the war time that we are living through. But because we are going back to normal life, I think that it will be even more difficult to convince people. And I think that one of the points right now that we are discussing a lot in Israel is about the vaccination of 12 to 70 years old children. And I must say that we are still not there, but we are discussing a lot about that. And I know that in US you have started, and this is where we are. Did we answer to your questions?
Yes, of course. Thank you, Peter. Thank you, Irene. Another question that I had was, I was recently listening to a few experiences, clinical evidence experiences from, there's a video that is there with Dr. Chetty from South Africa, and one is from Dr. Matthew Pogisi from St. Stephen's Hospital in India. So they have talked about the clinical course that takes, and Dr. Chinmay covered it very nicely in his presentation about how the timing of detecting the infection is very important. And what they said was that the first 5 days, 5 to 6 to 7 days are it's the viremia phase, when the virus multiplies, replicates. And then starts the hypersensitivity or the clotting phase, when it's not actually the virus working, it's actually the body's immune system that is working against its own self. And that happens only in a few of people who get into the stage of where they will need oxygen. And this stage can easily be controlled with administering steroids and antiallergics. So that's something, the evidence-based people who have treated. So what I heard was Dr. Chetty from South Africa, he's treated 4,000 patients until now, and he's not seen any severities at all, as in no hospitalization or severity going, if it was treated per the protocol that he was following, which he probably improvised. Yeah. So, and also Dr. Matthew Pogisi from India, St. Stephen's Hospital. So he spoke about, so he didn't say about severity, but what he said was it is controllable if it is detected at the right time. And, you know, 5th or 6th day would go to the hypersensitivity phase. So since, you know, being clinicians, what has been your experience with, you know, treating patients, and is it because, you know, that those when we read or listen to, you know, clinical evidence, it is quite, it brings hope that it's not a completely untreatable disease. You know, of course vaccines are working, but until that is there, so yeah.
I think that Dr. Subhrojyoti, who has many patients in his hospital, could answer this question. But I have also something to say. But please.
No, I think what Dr. Arshia is saying, I will just say that, you know, this is a pandemic, and if we really look at, there is no set guidelines. And when we look at, if you know, in India also, we have to be very adhere to, and any other developed country, you have to adhere to what the evidence says. The worst part and the best part about managing COVID-19 is that the guideline is changing at every day. I mean, today we are now thinking that remdesivir doesn't work. It's an ineffective, useless drug, is what the Indian government is now thinking. Whereas people have sold their houses to buy remdesivir in the country. So I mean, was that worth of? So to answer your question, I would say it is the Ministry of Health of that individual country should take the initiative and give the guidelines. And I have followed, and I am telling you that whatever our Ministry of Health has given, I have followed those guidelines. It's a safer bet because medico-legally also it saves you. Suppose tomorrow if the patient decides to go to the court to legally sue you, then what is, I mean, these, we need to have some evidence, or we need to tell the people on what basis have we treated. So I am practicing as per what the Indian ministry is recommending. If the Indian ministry is not recommending that particular evidence, we are not writing. So this is my take on this.
I'm sure that someone has to can add something to that. No, we have set up in Eyes of Israel. We have set up a task force on vaccines, and we have been working for several months about that, and working on the question and answers. And what I'm feeling is that we have tried during this last year, we have tried several protocols. And right now, the only protocol, it's not a protocol, it's like a usual care, that the standard of care that we have seen, it's oxygen, it's steroids, and they are the only ones that are really evidence-based, we can say. And all the other ones, I think we have tried the plasma therapy, it's not working. We have tried several. So I think that the level also, the level of the healthcare system is very important to cure these people, to treat. But till now, we don't have a real treatment for the COVID, and better to be vaccinated than to wait for another treatment.
I have a question. Pardon me, in Indian hospitals, is there adequate supply of dexamethasone?
Yes, we have adequate supply of dexamethasone, both in injection as well as in tablet form. So what Dr. Irene said, you know, I echo her thought completely, that it is only the steroids and it is the oxygen therapy, and if I could add low molecular weight heparins,
yes, of course,
the blood thinners. These have, you know, the evidence, and vitamin C's, the vitamin D's, and whatever, all the vitamins, they actually don't have any evidence whatsoever. So, but having said that, I think it's more an expert guidelines which are kind of dictating the treatment methodology across the globe, not only in countries like India, but across the globe. So this is a collective decision taken by senior physicians or a group of physicians, and they tend to actually, if I could use the word, use the cocktail regime, so that everything is taken care of, both evidence-based as well as not evidence-based, and that is the best way to deal with it. Because I can talk about the Indian guidelines, which says that in mild disease, one of the Indian states has recommended to use ivermectin and doxycycline, whereas we know that the data for ivermectin usage is very, very minimal, very, very minimal. So this is but as I told you, we to ensure, the government is also insisting that have standardization of treatment. What is very, very important right now during the pandemic is to have standardization of treatment. And in lower and middle income countries like India, where the standardization of treatment varies to a greater extent, I think following the ministry's guidelines can be a good helping hand to have standardization across patient treatment.
Do we have any other question? Okay, I think that it was really a great session, and I cannot enough thank Dr. Chinmaya, Dr. Maya, and Dr. Subhrojyoti for this very exciting session. And I would like just to close the session with a few slides about the next session. And our next session is within about 1 month, and it will be US, Israel, and UK, the 3 countries. And we will start with US with Professor Peter Pitts. I just remember you that Peter Pitts is the president of the Center for Medicine in Public Interest, and a previous FDA associate commissioner, and is advising Ministry of Health all over the world. So it's really a great honor to have him with us today, and we will be really very impatient to hear him about America programs. Then we will have Professor Cyril Cohen, who was just speaking just at the beginning of this session, and is part of is an immunologist, head of the immunology department, and is also part of the government committee for the trials in vaccines, COVID vaccines. We will have Professor Yuval Feldman, who is a professor in law, speaking about the Israeli green passport. So it will be the legal aspect of this green passport. Then someone will talk about vaccine safety in the UK. We will have Sue Sherman. She is a psychologist, and she's teaching in Keele University in UK about the acceptability of the vaccination. She is leading a study nationwide about the way that the vaccination acceptance is moving. And then in our speakers panel, we will have Professor Nick Sevdalis of the King's College of London. He's head of the Center for Implementation Science and Patient Safety. And I think that it will be a very, very interesting session. And then on 7 July, we will have the Latin America. For the time being, we just have Dr. Raquel Herrera Comoglio. She's head of pharmacovigilance of the Center of Pharmacovigilance in the University of Cordoba in Argentina. And she was the leader of the Latin America chapter in ISO for a long, long, long time. And then just few words about what we are doing in Israel. We have a task force of 20 high-level people, and we have made some. We have written frequent asked questions about vaccines. We have articles. It's available. It's free and it's available to anyone. We have a press review on Facebook. We have a chronicle of scientific literature and scientific in French and in English. Everything is open to everyone, so you can just have to send a mail to our contact isopisrael.org. And so don't miss our next session on 9 June and 7 July. Have a look at our information on our website. And thank you so much for participating to this great session and to this collaboration between India and Israel that are very friendly countries. Thank you so much.
Thank you, Dr. Irene. Thank you for this wonderful session. And we really hope that Israel completely eradicates the disease. And
yes, stay safe.
Thank you, Dr. Irene.
Yeah. Thank you, everyone. Thank you, Dr. Peter. Thank you, everyone.
Thank
Thank
you.
you, everyone.
Thank you. Bye-bye. Stay safe.
Bye-bye. Stay safe and come back to on the 9th of July.
Yes, absolutely. Thank you. Thank you.
As usual, Irene, you made something very, very, very interesting, and we are really, really proud of it.
Thank
Bye.
you.
I'm closing the session, and again, thank you all the participants.
Bye-bye. Goodbye, Dr. Shinmaya, Dr. Maya. Bye-bye.
Bye. Bye.